Welcome, occupational home health care employees, to today's session on infection control. So we'll start off by talking today about infection control and the fact that no matter how you look at it, infections are nasty. An infection is an invasion of the body by a pathogen or microorganism, which we usually can call a bug. These bugs can cause a variety of symptoms such as redness, swelling, pain, and/or fever. Infections can be transmitted in three ways: direct contact, which includes touching blood or other body fluids; indirect contact, which is touching items that have infectious material on them, such as bed linens, bedpans, drinking glasses, etc. And then there's what we would call vectors, which are flies, mosquitoes, or other insects that are carrying the bug or bacteria. Three things have to be present in this vicious circle in order to spread the infection: an infectious agent such as a virus, bacteria, or fungus; a susceptible host such as one who has a weakened condition or is ill; a chain of transmission for the infectious agent to move to the susceptible host. Remember that the most important thing for you to do is to prevent the spread of infection from you to the patient or the patient to you, which could then go on to others around you. You must do everything you can to prevent the spread of infection. So, ways or things that you want to do to prevent the spread of infection. If you have a cold or other infection, check with your supervisor, who will determine if your job duties can be performed without a risk to the patient according to the agency's policies. If you learn the patient has an infection, report it to your supervisor. Learn everything you can about preventing the spread of infections. Always practice standard precautions. Wash your hands religiously. Wear gloves when there is a reasonable chance you will come into contact with blood or other body fluids. Wear gloves if you have any open areas on your hands. Use personal protective equipment when there is a reasonable chance you will come into contact with blood or other body fluids or airborne bugs. Clean and disinfect any surface which has come in contact with blood or other body fluid or could be exposed to an airborne bug. Dispose any infected materials per agency policies, and if appropriate to your job duties, follow the agency policies for blood collection and transportation of specimens. If it's inappropriate to your job position, document according to your agency policies. Thank you. That's all I have for today.